Hello everyone. Once again, I welcome you all to CareerInPharma. Now, this is another episode of our Expert Show Talk series. Where we are going to talk with Dr. Hariprasad today, who is BDS by degree, and after that, he started his career into medical coding. So let's begin this video, and from this interaction you will understand how after BDS, and if you want to start your journey into medical coding, how you will be able to do it, what are the steps to make a career into medical coding. So that you are going to learn from today's interaction. So let's begin this interaction, and I hope you're really going to love it. Yes, so let's begin. Yes, guys. So once again, welcome to CareerInPharma. Now today we have Dr. Hariprasad with us, and basically he is dentist, and then he moved into medical coding. So now from today's interaction, we will understand what is medical coding and how you can leverage your knowledge, whatever you have gained in your graduation, especially for dentists, how you can leverage that, how you can get entry into medical coding, and what exactly is medical coding and if it's for you or not. So these many things we are going to learn from today's interaction. Now my humble request to all of you is please stay till the end to get maximum out of this interaction. Yes, many of your queries will be answered through this interaction. So just stay tuned till the end. Yes, good morning, Dr. Hari.
Good morning, Dr. Neema. Good morning. And hello to everyone who is watching this.
Yes, and thank you, Dr. Hari. Before I proceed further, let me say thanks to you from bottom of my heart, because it's Sunday and it's off for everyone. So you are taking time out of your busy schedule and your holiday. So thank you for that.
Yeah, that's not a problem, Doctor. It's my honor to be part of this conversation.
Thank you. So without further ado, let's start with your introduction, Dr. Hari.
Yeah. Hello again. Hello to everybody. Myself, Hariprasad. I am a CPC certified medical coder, and I am also a dental graduate. I am into this field since almost 1.5 years now. Earlier, I was working as a dentist for a very short period of time. In fact, I worked as I volunteered for a dental clinic. Then during COVID time, I kind of planned to change my field to medical coding. Yeah.
So Dr. Hari, with this, one question is coming to my mind, because for our viewers also, Dr. Hari is from Government Dental College, and we all know to grab a government seat is not an easy thing to do, especially in medical field. So after being from, it's tough competition. Everyone understands. That is different thing. What is the scenario after that? But to grab that seat is not an easy thing. So you grabbed government dental seat also, and you did BDS from this GDC. Now my question is, because you completed your BDS in 2021, so you are very fresh. Then from where this idea came to your mind regarding this medical coding, or its serendipity, and how it was? How
the culprit here is the culprit here is COVID, Doctor. During my internship, the second part of my internship, the COVID wave hit, the whole country. So that time, we kind of got an opportunity to think what can be beyond, just practicing in a clinic, or to go for the MDS, or is there any other options available? That time, I kind of bumped into this person who was working as a medical coder. Before that, in fact, even I didn't even know that there is such a thing exists as medical coding. So then he introduced me into this field. Then I kind of tried to try out for a temporary basis to work as a medical coder. Since this is a big industry. Then I later got to know that there is a huge opportunities available here, so we can continue this field itself.
So Dr. Hari, it means you started without becoming a certified coder, or how it was?
No, I started as a certified coder itself. I took a training earlier for about 3 months. After my internship, I took a training. Then I joined as a medical coder.
You cleared your exam also, right?
Yes, doctor.
Oh, so you took training in internship itself, right?
Not like that. I know after my internship is over, I practiced for couple of months outside. Then after that, I took an internship. I took a training for this certification. Then I wrote the exam. Then I joined as a medical coder.
So with this, I just want to know. Definitely we will talk about the certification because many, of our viewers, people, they don't know. They think that they can get job directly into medical coding. So yeah, that question I will take later on. Before that, I just want to understand from you. Because see, in clinical, we see the direct impact. Patient coming to us in pain, we are just giving the treatment, there is no pain. So we can see the impact directly, on the spot. But here, just in the layman terms, if you can explain what is this medical coding and what is the impact, how it's, creating the effect or that we can see in the front end.
Yeah. Just put it simply, this whole thing is called as revenue cycle management. So medical coding is part of this thing. So there are other parts as well. So medical coders, play a crucial role in this revenue cycle management. So basically, we are working for a US healthcare process. So the thing is, most of the people there will be having insurance, right? And once they go to a clinic or let's say dental clinic, they went to dental, they don't directly pay out of their pocket. So they will be having insurances on their office will collect their insurance details, and the doctor will do the treatment, and the patient go back to his home. He doesn't really pay for that service out of his pocket. So in the background, we will process the patient's details and all those things to submit to the insurance. There we will play a crucial role as a medical coders. So in medical coding, the thing is, we will assign a certain codes for procedures as well as for the diagnosis. So it's a for procedures there is a 5-digit code. For diagnosis there is a 7-digit code, up to 7 digits it can go. So we have to link both of them and to submit to the insurance. This in basic things we can understand it like that.
Okay. So basically you are converting that report into medical codes.
Yes.
Yeah, that going back to insurance companies, and then they just check it if how much insurance money is there, right?
Yes, that's true.
Okay, got it. So yeah, it is a connecting link. Okay, got it now. Okay, so just want to know, I don't think so you must have encountered many challenges because you already started very early this medical coding, but still everyone has their own challenges, where everyone has their own journey. So can you take us through some challenges which you faced during transition? Because see, clinical is entirely different and it's a desk job, right? Medical coding. So how you overcome those challenges? First, what were the challenges? Second, how you overcame those challenges?
Yeah, initially I struggled, the challenge was for me to transition from a clinic to an office setup. So this was the biggest challenge, to sit in front of a system or a laptop for whole day. Yeah. Earlier we would be sitting with a patient or clinic staffs. That's a different whole scenario. When it comes to here, you work as you don't really be in a clinic. You work as a supporting the system for those clinics that who really does the work for patients. So it was a really challenging situation for me initially. Then later, I got adjusted to this field. So now I am really into this field.
So just want to know how much challenge you faced in terms of using laptops. I would not say big things, you just on the laptop, you see what it is. How much challenge you faced in that, or you already were into all those things?
Not at all, doctor. Earlier, I didn't even know how to, properly type a word in a laptop, because right now we are, in medical coding, you'll be working with Excel, lot of Excel sheets. So that was the biggest challenge for me to, type something. Earlier, I struggled a lot to find, where is which alphabet. So that was a difficult thing. Then after like 4 or 5 months, I got adjusted. Now it's not a problem.
Yes. So guys, it takes little time. Everything new you do. So yeah, because especially people who are from clinical background, it's kind of a phobia using laptop systems. They can do the work, right? Work is easy, but they have the big, even I had that phobia, like how I'm going to use this laptop, that is the biggest phobia. We don't do in, clinics, so that is why. So yeah, everything is possible. This next question is, Dr. Hari, see, in our YouTube channel, we get a lot of queries from even software engineers, BTech CS branch. And they say they want to do medical coding, because I guess they are just thinking that it is like a coding which they do in software. So if you can little explain that, if BTech guys can do it or not. For BTech, definitely it's better to go into their core area. So yes. It's what kind of coding it is? It's not that software coding, right?
The only similarity between software coding and medical coding is both of you will be using the system. Other than that, there is no similarity between these two coding. Even for me also, most of the people come and ask me, is it like software coding? No, not at all. The only thing is, since we are using a separate codes for procedures and the diagnosis, that's why it's called as medical coding. Apart from that, there is nothing similar.
Yes, guys. So this is only the word. Otherwise, it's totally different. We are not doing any programming in medical coding. It's entirely different. So for BTech CS, guys, you can continue into core area, where definitely there are endless opportunities, because everything is software related nowadays. Yes. So with this, Dr. Hari, next question is, which is very important. If any person want to start their career into medical coding, how they can start, what all certification is required, or if a person can get job without certification also. Please throw some light in this also.
Yeah, I would suggest, to whoever want to pursue this career for a long period of time, and to be in this field for a long period of time, to make this as a primary source of income, then I would suggest for them to get certified. For other people who just want to see what it is and still in a dilemma to whether to be in this field or to go back to some other fields, then no need of certification, because it's quite expensive as well. So I would suggest, if you are planning to coming into this field and you really want to be in this field, then get certified.
Yes, guys. So yeah, definitely for your future growth inside this field, you need to become a certified coder. And if you want to explore, you can just take some job without certification. Just explore if it's working for you or not. And if you really want to carry it further, then you can take certification. Yes, Dr. Hari, it makes sense, right?
That's really true. Yeah.
Now with this, I want to know, how is the future growth in medical coding in terms of, because there is a lot of buzz, AI, ChatGPT. Like, I'm from pharma, so there are some process inside pharma industry where definitely this AI, ChatGPT, all these things going to come. Not very soon, maybe in next 5 to 10 years. How it is in medical coding?
Yeah, I would say it's almost the same with medical coding as well. There are also, that's the phobia of AI coming and taking their jobs, and they becoming jobless. There is a thing, but it's not like it's not so easy for just to say AI will take over my job, something like that, because there are so many other things that we will be doing, and we will be assessing and reviewing those things that AI cannot do it right now. Right now, what is the status of the artificial intelligence is there. If they can get updated, maybe they can take over that also. But right now, I think it's not possible immediately.
Immediately, correct. So it means it will take little time, because the AI, chat GPT, all those things which we have currently, even they are not evolved, right? So yes. And especially this is my personal opinion, like personal experience, that as anything which is related to human life and all those stuff, complete take of AI is not possible. Human intervention always required.
Definitely. AI can make our jobs very easy, but it cannot completely take over our field.
Correct. Yes, exactly. So with this, Dr. Hari, next question is, now many, especially I am talking about for clinical background guys, because many think that it's a laptop job. What will happen to my knowledge? Maybe my knowledge will get wasted. Whatever we have learned in our 5-year duration and all those other, these kind of thoughts comes to any newcomer. So how much use of there in medical coding, of your clinical knowledge with what you gained in your graduation, how much use of clinical knowledge is required?
Yeah, if it was just a data entry thing, I would not be doing this thing at all. So it is not data entry. Definitely it is not data entry. The thing is, you will be encountering various different types of procedures that has been carried out. You may be reviewing a dentist records, or you may be reviewing a record which has for a patient for major surgery has been carried out. So you will be using all of your clinical knowledges over here. Let's say you are checking the medical record of a patient for whom some major surgery has been done. None of the things that you have learned will go wasted, because all of the things that they will be using is medical terminologies. So don't worry about that. Your clinical knowledge will be very, very useful, because what others can do in half an hour, you can do it in 5 minutes.
Yes, true. So guys, don't think that your clinical knowledge uses will not be there, and then you will be totally doing data entry stuff. Nothing like that. There is a huge role of your clinical knowledge, medical knowledge, whatever you have gained in your graduation. And that's why company give a lot of preference to doctors, be it pharma field, be it medical coding, like anything which is related to medicine, clinic and all those stuff. Yeah, so you always have an edge over others without doubt. So yes,
I would
Dr.
like
Hari.
to add one more thing, doctor.
Yeah, please go ahead. Yes.
Yeah. Usually the billing companies will look for people who are having this life science background, especially dental or medical or Ayurveda, because it is useful for them. Because they don't have to train them much more about the anatomy and physiology. So you will be on the top if they are selecting you.
Yeah, 100%. Because anatomy, physiology is still anyone can learn, but anatomy, I don't think so it's that easy, right?
Yes,
we have learned for one whole year. It's not that easy subject that you just give to any life science and they will just learn. We have just seen everything, from dissection, each bone and everything. But definitely for it's far easier. So yeah, definitely for medicals, from people who have already learned anatomy, physiology in their graduation, I would say as compared to life science and other graduate, it's like a cakewalk for you guys, especially for anatomy, physiology, because we have already learned so much in that. Yeah, so with this, Dr. Hari, next question is, if you want to, tell any fresher, what steps they should take to make a career. Let's say they want to make a career into medical coding and they want to start from today. So what steps you will suggest to them, how they should go?
Yeah, if you want to start as a fresher, then the first thing I would suggest is again and again I'm repeating, please get certified. If you seriously want to go into this field, please get certified. Because only if you get certified, people will consider your resume seriously. Otherwise, they will come to you if there is no other option. So if you get certified, there are more other things. It's not only the CPC certification. Once you get into this field, there are many other certifications that can be add on to your that can be add on. certifications. So it's really good that if you get certified, even otherwise also if you can take some time and later after 1 or 2 years you can also get certified. But I would suggest you get certified and then go into medical coding.
So, Dr. Hari, what about the fees for this, becoming a certificate, that exam writing fees? How much is the fee?
The fee is like there are two types. We can divide it like two types. If you're taking a single attempt examination, then it would be around in Indian rupees it would be around 45, I guess. You need to pay for the 45K. Like you need to pay for the membership first, then for the examination. So if you're taking for the like 2 attempts, if you're kind of in a dilemma, whether confusion that whether you will be able to pass this exam, then I would suggest you take the 2 attempts in a single payment. You can take for the 2 attempts, so it would be around 65 to 65K in total.
Okay,
it depends on the US dollars.
Fee? US dollars, yeah, definitely it will go up. Yeah. So is there any separate fee for membership?
Yes, doctor. Initially we have to pay for the membership. Then if you are taking the examination, the membership is must. Only if you get the membership, then only you will get to write the examination. So both included, it will be around 45K.
Okay, and this membership is lifetime or it's like annual?
No, it's annual. Once you get into any company, they will be renewing your membership, so no need to worry about that.
Oh, then it's great.
Yeah,
it's very much similar to our what we do, our registration, no? PCI registration annual.
Yes.
I mean, that is not annual, that is like every 5 years, I guess, right?
Yes, I think so.
Okay, something like that. You have to renew it.
Yes, your company, your corporate will be, you will be linked once you get into a company. You will be linked to the corporate membership. So in that way, they will be renewing it.
Because every company also must be having membership, right?
Yes, doctor.
Okay, so in the same steps, like try to become a certified coder. This is the fee and all those stuff. Now the third thing is, what about the preparation part? What all things they need to prepare for exam? Or is there any online resources available or books available? How it is?
I initially started with watching YouTube videos. There are plenty of YouTube videos. First thing is I would suggest you check for 2024 updates of any YouTube videos. Like if you're checking for there are 2 things, CPT and ICT books that will get updated every year. So whatever the guidelines that were there in the previous year, that might not be there. That there might not be significant changes. There would be some changes. So I would suggest you, when you're watching YouTube videos, you watch the recent ones. So that way you will get updated about the recent changes. So other thing is, other online sources, I didn't go for it. I took a training from a training center in Bangalore. So in that, they also helped me for the job placement.
Okay. And what about understanding of anatomy and physiology, especially because we do get a lot of queries? You will be surprised to know people who are not just life science, like humanities, BA, those guys, if they want to come to medical coding, is it possible for them? And if possible, how they can do, like anatomy, physiology, how they are going to do it?
Yeah, we have few people in my current company itself. They are from different background, not at all related to medical field itself. So they're from engineering background. There are most of the people come from BSc, MSc. So there are people from different backgrounds. So for them it will be little difficult initially. So they don't start off as a medical coder. They would come as for a different thing to a billing company. then they would see, they would understand what things are going on here. So what is the best thing they can do? So they make some friends with, medical coders. So then they will understand what is this thing. So that's how they come into medical coding field. So if you are from non-medical background, yes, it will be little difficult, but no need to worry. You have to put extra, efforts.
Yeah, just little extra efforts required. Definitely, there will be a difference from a person who is from medical background versus you, but it is not impossible. So yeah, extra efforts required, and you need to collect more information. You need to put more efforts. Those extra things will be required. Yes.
Yeah.
So with this, Dr. Hari, just want to know regarding job opportunities, like job, because every field has their different things. Regarding medical coding, from where the person, they will be able to know about the job updates, or any site if you would suggest where they can look for jobs into medical coding at a fresher level.
Yeah, as a fresher also, or as an experienced also, I would suggest LinkedIn is a great place where you can search your suitable jobs. So the only thing is LinkedIn for me right now. Like say if you want to say somebody, for some fresher is looking for a job, I would say LinkedIn. Or if you have any, basically for freshers, most of the training or coaching centers will be helping them to get placement. So for freshers, it's better, if they get trained, they will also have an advantage of not worrying about their placement.
Yes. So that is the thing. I mean, from wherever you are doing the training, that company will help you in getting placed as well. Okay, so
yeah, most
in
of
that
the time.
sense, most of the time, yes. And definitely you have to put your efforts on. That is for sure. So yeah, this is regarding where you can get job updates. And yes, LinkedIn, a very important thing you told is LinkedIn, because LinkedIn is very powerful tool, because things are changing now. From Naukri, indeed, it's shifting to LinkedIn.
Yeah, so, definitely.
Yes. So yeah, LinkedIn is really very powerful. I mean, you never know who is watching you, like company CEO or any recruiter, consultant, and suddenly you will get a DM one day. But for that, you need to be very active on LinkedIn. You need to have a very good profile where you can showcase what all expertise you have. So yeah, LinkedIn is one of the powerful tools. Yeah, with this, another question, Dr. Hari, especially for you, because you are from clinical background. Now, many people, they ask that with medical coding also, can we continue our clinical practice as well? I mean, on daily basis, it is not possible, I understand. But let's say if anyone want to just continue on weekend also, whatever time they have left apart from job, is it possible to continue clinical?
I would say yes, you can do it, because it will be, since it's IT field, we can, most of the companies will be having 5 days of working, in a week, that will be 5 days of working days. So you will be having 2 more extra days that you can put in for, dental clinical use. So in that way also you can do it. Otherwise, if you really want to, make this as a, make this, thing as a prime, source of income, then I would suggest you update yourself in the same field. Instead of going for a dental and again coming back for a coding thing, it's good to update yourself in the same field.
Yeah, that is also a powerful tip. You can, on weekends, you can utilize your time. Like Dr. Hari already mentioned, you have n numbers of other certification which you can do apart from the basics one. So you can keep upskilling yourself, you can keep yourself updated to the latest info, and yeah, many things are there to grow inside coding as well. Yes, so with this, Dr. Hari, one of the biggest learning for you from industry, medical coding, and any regret if you have after coming to this industry?
I will start with a regret. Only thing I'm regretting is the patient interaction. The humility with which the patient, once you treat the patient and they are happy, that thing you won't be able to see here a lot, because there is a face-to-face contact with the patients. Here it's not so. You will be on the system most of the time. So that thing I regret. I miss that thing. And one more thing you asked is, can you repeat that?
Your biggest learning.
Yeah.
Your biggest
Yeah,
learning.
my biggest learning is, you update yourself, so that nobody can deny you anything. Oh, that's the biggest learning. So you think that once you come into medical coding, that's the end of it. No, you update yourself every year, because it's not like dental books. Dental books I have never seen getting updated. In my last five years of 5 years of dental learning, I have never seen it's getting updated. So here the books will get updated every year. So you have to be on, on the guidelines part, because if you miss a certain thing, the doctor could be losing a lot of money, because you will be assigning the code, which, the value of that code could be $100 or $1,000 or $2,000. Nobody knows. So that's why I keep telling, please update yourself.
Very important. I mean, yes. Very true. You said that in our dentistry, like same curriculum, not much of changes, but here every year codes get updated. If not major update, some update will be there for sure, right? Even a small change is a big change, like Dr. Hari said. You never know. Some procedure is $1,000, some is $100, or might be you are using old code, because of which the doctor might have to suffer, and then many things at the back end happens. So very important to update yourself. That is the biggest learning for Dr. Hari, and definitely even I agree on this. I mean, in this world, if you really want to grow, you need to update and upskill yourself regularly. Yes. And like you mentioned, patient interaction is something that kind of satisfaction you're not going to get, I would say, in terms of patient interaction, because that is very different level. Where you see the patient, you get that satisfaction from their smile, their pain is gone, then they're happy, then they're coming back to you with smiling faces. That is really a different thing. That kind of satisfaction in corporate, very tough to get. But yes, still people who want to continue, they can go to some maybe dental camps or something they can do on weekend. There are many other ways also giving back to society.
Yeah, definitely they can, if you don't want to get paid, they can volunteer some, in some dental clinic as well, so that they can also be in touch with the dental clinic.
Yes. True. Yes, so with this, Dr. Hari, it's time to conclude this interaction. Anything else apart from whatever we discussed? Anything else you want to share with audience, or anything which you want to tell to them from your end? Anything?
Yeah, I just want to conclude with saying that if you are whether from non-medical background or medical background, so don't make a conclusion in the beginning itself. You need, please stay in the field for some time, then you will get to know more things. Then you can decide whether you want to be in this field, or you want to go back and go back to whatever you were doing earlier. So don't make the conclusion in the early stages itself. That's all I want to say.
True, 100%. You need to give some time to whatever you are doing in life. Some time you have to give, then only you can decide, and final conclusion you can make. Otherwise, growth is there. I would say in every field growth is there. What matters is your consistency.
And definitely, doctor, only if you are a mediocre person, then it's a different thing. If you are a talented person, really want to do something, then wherever you are, you have a growth.
True, 100%. I agree on this. True, 100%. And yes, keep upskilling yourself, keep learning new things, keep yourself updated. And because especially, like how is the dental market in India? I mean, what is the thing, so many colleges, everything. Trust me, Dr. Hari, I have many dentists in our community, through our YouTubes, our viewers. Really, after completing their 10 years of BDS, 15 years of BDS, especially for females, they're not doing anything at all. You can understand that their 5 year of degree, It's like they are not doing
Yeah,
it
one
all.
more advantage. One more advantage in medical coding field is if you are lucky, you can get a work from home job as well for all the ladies.
Yes, true, agree.
Yeah.
This is something which we can get in, this desktop and all those sitting jobs. Because if you're really doing very good, your performance very good, I don't think so any manager won't allow you work from home. I mean, it's up to managers and all, because work can be done from office, from home also. So work from home is a big advantage for females. True. Yes. So with this, once again, thanks to you, Dr. Hari, for telling everything in a layman terms and putting out all the basic points. And definitely, I think it will help our viewers to understand medical coding. And once again, thank you for coming here and sharing these valuable insights.
Thank you so much, Dr. Neema, for inviting me.
Thank you. Thank you. Hey guys, first of all, thank you for watching this video till the end. And I hope you really liked this interaction, and I hope you really learned a lot from this interaction. So let me share my key takeaways from this expert talk show interaction is keep upskilling yourself in life, because without that you are not going to get a boost in your career, you are not going to grow. So this is my key takeaway, and please share your key takeaway, key learning from this interaction in the comment section below. And also, if there is any query regarding medical coding, please keep asking in the comment section below, and I would love to read all and I would love to reply all. So with this, I'm going to conclude this. And guys, please don't forget to like this video, share this video with your friends, and please do subscribe to our channel. Thank you. Have a nice day.